All right, hello everyone. Thank you so much for joining me today. My name is Brendan Hawkins. I am a senior at Travis High School. Really excited to have all of you here today to sit and listen to my presentation. Just a little bit of prefacing. So throughout my mentorship experience, I was with a nonprofit organization that's really involved in the fields of public policy, advocacy, and all that. And what really interested me was this intersection of public policy and healthcare, kind of looking at how decisions and policies made at the federal and state level can have direct impacts, consequences on the lives and health outcomes of people. And what was really unique about my experience was the fact that it worked right alongside the Texas legislative session. So for those of you who don't know, the Texas legislature only meets once every other year for a period of about 140 days. And basically in this really short amount of time, they're drafting, debating, and passing legislation that's going to impact millions of Texans. So today, what I sort of want to do is look at the current state of healthcare in Texas, look at some different bills that are currently in the works, and then based on different trends in my research, give ideas for improvements and suggestions. Just to make sure that we're all on the same page throughout this presentation, I did want to go over some common terminology. So you have Medicare versus Medicaid. Medicare is going to be for those who are elderly, so 65 years old and up, whereas Medicaid is going to be for those who are low income. And for the most part, Medicaid is overseen by the state government, which is why the policies and bills at the state legislature are so important. And some acronyms that I might be using throughout this presentation, you have HB, that means House Bill. You might see SB in other places, that means Senate Bill. It's just talking about which side of the legislature the bill originated from. CHIP, that's going to be your Children's Health Insurance Program, which works alongside Medicaid. And UC, that stands for uncompensated care. These are costs faced by emergency rooms, hospitals that basically go unpaid for by either the patient themselves or insurance companies. And so my project is entitled Everything is Bigger in Texas, but what about healthcare? Obviously, we're one of the greatest states when it comes to economic growth, population growth. We recently won 2 House seats based on the 2020 census data. But let's look at one of our weaker areas. How is Texas doing in terms of healthcare? Well, for one, Texas is going to have the highest rate of uninsured people in the nation. So about 18% of Texans are currently uninsured. That's going to be about 5.2 million. Looking specifically within the Houston area where we are, that number is 22%, so almost 1 in 4 Houstonians. Then when we're looking at communities such as Brownsville, that number can be upwards of 30%. 18% of adult Texans have also not seen a doctor within the past 12 months, which is really worrying whenever we're looking at lack of preventative care within our state. In terms of issues faced by people who are currently in the Medicaid system, one really big issue is this fluctuation of eligibility for newborns. So the way it currently works is that at months 5, 6, and 7, you have an eligibility check, which basically determines your financial eligibility. So let's say you make a couple $100 more, pick up some extra shifts, you're automatically kicked off of Medicaid and the newborn loses eligibility. And then in terms of mothers are only eligible for Medicaid up to 2 months postpartum. So we're not really seeing a lot of investments and supports into long-term maternal health care for our mothers. So how are we doing in comparison to other states? Well, in terms of rankings, Texas is going to be 47th for overall healthcare. We are last in taking care of Hispanic communities, which is really worrying whenever we're considering the sizable Hispanic population within our state. And we're also 41st in healthcare for high income people, meaning it's not entirely a matter of wealth or income disparity, but more so a matter of poor policy and poor infrastructure within our state. We're also going to be tied with Alabama for the lowest income cap for Medicaid, meaning we're really restrictive in determining who is and isn't eligible for Medicaid. And then, some of you might be thinking we're right here in Houston outside of the Texas Medical Center, where it's probably regarded as one of the best places when it comes to treatments for cancers, which yes, it is true, but whenever we're looking at admissions rates for preventable diseases and complications, so let's say complications arising from flu, hypertension, diabetes, there are abnormally high rates of admissions for these in the Texas Medical Center. And so this is obviously an issue that needs to be addressed. What is currently being done at the state legislature to address this issue? Well, first you're going to have HB 133. That's looking at extending the eligibility of mothers from 2 months to 12 months. So 1 year of continuous coverage for our mothers postpartum. HB 290, that's looking at streamlining that eligibility of newborns. So rather than having those eligibility checks at months 5, 6, and 7, it would only be 1 eligibility check on month 6. And something that was interesting that arose this current session was the Texas House Plan on Healthcare. This was basically a bipartisan package of bills introduced by the Speaker of the House and some other members looking at tackling the issue of healthcare within our state. So on top of the 2 previous bills that I mentioned, it also includes some looking at expanding telemedicine. So this is a really popular topic in light of COVID this past year, and also just a great way in terms of reaching rural communities who don't necessarily have the proper infrastructure. They're also looking at reducing drug prices for those who are uninsured, because as we saw, we do have a really high percentage of our population who is uninsured. And so while these are all great steps in the right direction, in my mind, it won't be sufficient to get us where we need to be. So what more could be done? And this is where I want to come in with my research and give some suggestions. I'd say that the biggest thing would be to expand eligibility requirements. Let's raise that income cap because we saw how we are tied with Alabama for the lowest one. So I think right now it is if you are a single parent with 2 children trying to attain Medicaid for yourself, you can't be making more than $230 a month. It's a lot easier when it comes to children, but when we're looking at adults, it's really, really restrictive. Let's also expand it to those who are childless adults. Right now, if you're an adult trying to attain Medicaid, you must be the parent of a minor in order to qualify for Medicaid. Now, so let's look at expanding the requirements for those who are working with a disability. So let's say you have a disease such as Crohn's disease, multiple sclerosis, where you're still able to go out there, make a living for yourself. You're likely going to be exceeding that income cap, and they don't really take into account or factor in those really expensive and costly long-term treatments that you must receive. Let's also look at allowing for in-person assistance programs. These are basically community organizations that go out, they inform the public and help them basically navigate the entire application process because it's going to be pretty complicated. But unfortunately, Texas has really restrictive laws when it comes to these. So these are pretty much non-existent within our state. Let's also maybe look at requiring health insurance. So this is something that is not really popular throughout the country, but it is definitely present in the few states. And basically, in my mind, the way I see it is that if you are a Texas car driver, you're basically required to have car insurance, but the same is not true for health insurance. And I feel like it's just opening up the door for people to go really long periods without receiving proper health care and opening the door for them to fall into massive amounts of medical debt, let's say if an emergency arises. And something that was really interesting that I want to talk a little bit more about is instituting Medicaid expansion in accordance with federal government. So you can see right here in this little graph that Texas is one of 12 states that has not accepted federal expansion of Medicaid. And I sort of want to talk about what we are missing out on. So if Texas did choose to accept it, we would see about 1.7 million people in Texas be covered by Medicaid as well. So our uninsured rate would decrease by at least 6%, bringing us down from 18% to 12%, which is not ideal, but it is closer to that 30 in terms of state rankings. It would also increase federal funding. So you can see right here that we're currently missing out on over $110 billion of federal funding in the next decade alone. And these are basically Texas tax dollars that are going out, being used in other states, whereas we could be bringing them back in, reinvesting it into our own citizens. So we see a reduced outflow of Texas taxes, if Texas did choose to accept this federal expansion. We would also be seeing a decrease in uncompensated care costs for hospitals. As I mentioned, these are costs that go unpaid for, and Texas has a really big problem when it comes to this. I think it's about $5.5 billion every year is faced by our emergency rooms and hospitals. And this is in part subsidized by the federal government, but the deadline on that is coming up. And then we also just see a decrease in preventable hospitalizations, as we saw right here in the Texas Medical Center, which we have abnormally high rates of, and also a decrease in maternal mortality, which is a really big problem in Texas when we're looking in comparison to other developed states and nations. And so what is my role going to be into this? How will I play into this? Well, as of right now, my plan is to be going to the University of Chicago, where I'll be majoring in biochemistry and doing a minor in public policy. It's just a really great way for me to blend these two passions that I have, I feel like. But in terms of right now, I can continue to advocate at the state legislature. Earlier this past month, I went and learned how to testify in front of the committee. It was a really great experience, exposed me. So I'm sort of aware what the process looks like. But in terms of my professional career, I do want to do a career in medical research. And something that was really unique and I appreciate about my mentorship experience was the fact that I was able to join these weekly meetings with the Texas Family Leadership Council. And this was basically comprised of multiple professionals in different areas. So there was business leaders, there was lawyers, there was doctors. And so I feel like using my voice as a medical professional to advocate for my patients, for my community members would just be a really great way for me to just have a further impact in this field. And then something that I mentioned earlier was how Texas is unique that it only meets once every other year. And basically what this allows for is you have legislators who are from multiple different backgrounds. So you have doctors, lawyers, all of that. And so maybe once I'm more established within my career in the future, it's definitely a possibility that I could run for state legislature. Definitely not as something that is certain, but a possibility. I feel like it would just be a really great way for me to use my voice and definitely something that could be possible in the future. And so that is it for my presentation. I really want to thank all of you for coming here. I hope you learned something new. I did want to give a special thanks to Miss Mandy Kimball, Gretchen, Caroline. These were 3 lovely ladies at Children at Risk who just really helped me, gave me a whole bunch of knowledge. And a special thanks to Miss Bryant, my mentor instructor, for giving me this opportunity as well as so much wisdom. Thank you all for coming. If you have any questions or comments, you're free to ask them now, or I provided my email here as well. Thank you, and y'all have a great night.